Good afternoon and good evening, everyone, wherever you are. Today we have Professor Yesim Orhun from the Michigan Law School of Business. Yesim is an Associate Professor of Marketing and Michael R. and Mary K. Hallman Fellow, and she has a PhD from the University of California, Berkeley. Today she is going to present joint work with Ing Fan and Dana Turiaman on systematic differences in actions, beliefs, constraints, and risk tolerance during the COVID-19 pandemic. Thank you, Yesim, for making time for this seminar.
Thank you so much, Chirantan, for that introduction. And it's a real pleasure to present my work with Ing Fan and Dana Turiaman to you all. In this paper, we aim to provide descriptive evidence on factors that may be shaping individual actions in the pandemic. We care about individual actions because they shape not just the response, but also the transmission rates in a highly contagious disease environment. So what shapes these actions? Even the simplest model of decision-making under risk would have, at minimum, the risk tolerance of the person, their risk perceptions, the beliefs of efficacy measures. If I take this action, how much will it protect me? How much will it not? As well as the cost and constraints of taking those actions. So that's a lot of factors that go into one's decision, and they're likely to vary across people at all these levels. So what this paper is aiming to do is to document systematic differences across these types of actions, as well as the potential ingredients to those actions as a first step to understanding how to manage this pandemic and how to get people to do what's good for the society. At the end of it, unfortunately, the pandemic has shown us how much of a public health management is a public goods problem, because the individuals have to make certain sacrifices for the greater good of the public. And we're going to be relying much more on these individual actions as economies open up and the restrictions are lifted. So this paper is going to provide descriptive evidence on systematic differences in staying at home behavior during the times of state restrictions in the US, risk reduction behaviors that extend beyond the restrictions, the mobility restrictions, as well as the beliefs, constraints, and risk tolerance that may be shaping those actions. Now, I want to emphasize that this is a descriptive paper. It will not make any causal claims. And you may be asking, well, if we don't know anything causal, then what's the point of a paper, right? And so this is especially important to clarify upfront, because we believe descriptive evidence, early and careful descriptive evidence, is extremely important to understand where we must be looking causally. Imagine that you see heterogeneity across actions, and you study all the ingredients that may be shaping those actions, and you see heterogeneity in some of them, but not others. Then you can focus your causal energy, if you will, on those. And therefore, I see descriptive papers in this domain as a great first step to get to understand what's going on. And we're going to be looking at differences in these ingredients to actions, as well as the actions themselves, along the lines of demographics, where the pandemic might have had a differential effect and continues to probably do so. One is gender, the other is income, and the last is political affiliation. Why these three? Well, there is a lot of evidence and literature in economics talking about certain market inefficiencies causing women more harm, and sometimes women having different preferences that lead to different economic decisions. And three co-authors being all female, of course, we latched onto this idea pretty quickly to see if there are any differences. And a priori, we did not have hypotheses here. Income differences are for similar reasons around inequity and unfair implications of market frictions or inefficiencies. And finally, we're interested in political affiliation, because we're keenly aware of all the differences of behavior and attitudes reflected around us in the media. We're going to study these systematic differences in April 2020, when most of the states were under lockdown. I'm plotting here different types of non-pharmaceutical interventions that states enacted over time. And you can see that the month of April is when most states that had some sort of NPI had them in effect. Around May, this starts declining, and by June, most of the economies have opened up, and the United States is trying to come back to the new normal. So what we're going to do is look at these discrepancies in April, and then come back and look at it in the first half of June. And we hope to provide some intuitions with this time differential as well. Now, I'm in the habit of talking about results early in my presentations in the introduction, but to do that, I have to tell you a little bit about the two data sets that we're going to be relying on. The first data set some of you may be familiar with is the geolocation data from SafeGraph that tracks more than 35 million people's mobility around the US. This is anonymized cell phone geolocation data that comes from the many types of apps that people use that feed the company pings, and these pings will tell you the date, the timestamp rather, as well as the particular geolocation, which is coded to the census block group. From here, SafeGraph is able to calculate the duration of stay at a location, and for each device where their home is based on their nighttime location for a 6-week period. It's also able to calculate if you leave your home location, whether you're going to your work, because with the same algorithms they can calculate where your workplace is, between work hours for 3 to 6 hours, which is considered part-time, more than 6 hours, which is considered full-time. So we're going to be able to observe for each census block group, which we aggregate to census counties, the percentage of devices that stayed at home, the percentage of devices that left home for work reasons, and the percentage of devices that left home for other reasons. We're going to augment this data with the Clinton share in the 2016 election from the MIT Election Data Science Lab, as well as the COVID-19 cases and deaths from Johns Hopkins University, and several demographics at the census level from the census, at the county level from the census. Now, our second and main source of data is our survey, which elicits a wide spectrum of factors along a long time horizon. So first, we're going to be eliciting actions, not only those that are related to mobility that limit interactions, such as avoiding large gatherings or isolating, but also personal protection decisions, such as wearing a mask and washing hands. We're also going to ask respondents about, if they didn't take one of these actions, why. And we're going to code whether these reasons fall into being constrained or preference, loosely speaking, which I'll detail in a bit later. We're also going to ask for individuals' risk tolerance in a general way, as well as their specific beliefs around COVID. And these beliefs fall into two categories. One is individual risk. What is my chance of infection, and what would happen to me if I got infected? And we're pretty unique in this health outcomes if you're infected, the beliefs around that, which matter a lot. As well as systemic risk, such as globally, what is the US death rate? What is the effectiveness of states' non-pharmaceutical interventions? We're also going to measure people's worries about the economic and health well-being of themselves and those around them. And that's going to be some combination of risk tolerance and risk perceptions, but it's easier for people to answer. So we have that as kind of an additional data. We're going to conduct this survey across a large number of respondents and time periods. What we did is in April, we got the IRB in late March, and the first wave was April 1st. And then that was a Wednesday, and we did it every Wednesday in that April 5 times, collecting 5,500 respondents. We collected another 2,500 respondents in June. So that's the unique data set that gives us much mileage in our results. So let me preview the results. On the political affiliation part, Compared to Republicans, Democrats are much more likely to limit mobility, reduce exposure through precautionary actions. At the same time, they hold pessimistic risk perceptions, both about their own outcomes and infection risks, as well as more systemic risk around the US deaths. These findings contribute to a long-standing literature on partisan perception differences regarding objective outcomes. Where we contribute to this larger literature is that we show that partisan belief differences matter not only about external outcomes such as GDP, what's going to happen to the economy, which feels a little bit more distant to oneself, but also even when it involves personal risk of health and death. Our results overall, as I'm going to talk through them, highlight the need for unified information provision in a pandemic. And we're not alone in coming up with this message. There are several concurrent papers that also look at the correlation of actions and a few on beliefs with partisan differences. This correlation that we all document is very much suggestive of something amiss, something quite inefficient at the face of a common information. How come these people are so vastly different from one another? How we differ from these concurrent papers is threefold. First, our survey is much more comprehensive. Not only do we elicit actions and beliefs, but a much wider variety covering the spectrum of, especially when it concerns beliefs, all the ingredients to that simple economic model that would feed into making individual rational decisions. On top of that, we are the only ones that are eliciting constraints and risk preferences. Furthermore, we not only focus during on the period during the lockdown, but also after, as the economies open up, when more information is available, to contrast whether that gap is closing. And most importantly, this paper isn't all about political affiliation differences, but also focuses on gender and income differences. So let me tell you a little bit about our gender results. A priori, we didn't have a hypothesis. You may say, for example, in the political affiliation differences, well, we know pretty much how Democrats and Republicans are going to differ. What we're interested are in the details and the magnitude. Whereas here, I'm not quite sure a priori we know how men and women would differ. First of all, women may be more likely to be frontline workers, so they may be more out and about, but also traditionally have assumed the childcare role more intensively. So as public schools close, they may be actually at home with the kids. Those are some of the constraints that they face differentially. Some of the preference differences has been documented in the literature that women are more altruistic, also more risk averse. So how do these come into the picture? It's not all that clear, and we don't have any a priori hypotheses about any belief differences. What we find is women indeed are more risk averse here again, which is somewhat not surprising, because if preferences are stable, we would expect them to carry over here. But at the same time, they have higher perceptions of risk. And they take more precautions and have less mobility. Now, much of the economics literature on gender concerns itself with documenting inefficiencies or discrepancies or inequalities, something unfair. Here, we cannot really say that the differences are inefficient, because there are clearly differences in preferences. Now, if preferences have a role in shaping actions here, then we can say that positive externalities come from the risk aversion of women. And that has certain implications. We may want more female leaders if we want to minimize health risks to manage this pandemic. We want more female involvement in the policy making, perhaps civic engagement. So these are the things that we see on the gender front. On the income front, we find actually huge discrepancies in constraints. they are not able to reduce exposure due to work because they're often have to work and on the front lines. Their individual risk perceptions don't differ, which I find fascinating. They don't differ from higher income people in their beliefs of whether they're going to get infected more or what happens to them if they got infected. You may argue they may be optimistic here because we know that the healthcare they receive are drastically less quality. But their beliefs about the impact, the health impact on US is much more optimistic. They believe fewer people will die, and they're extremely worried about their economic well-being. So here there is an interesting, hopefully we'll have time to discuss, there's an interesting potential interplay between motivated beliefs and the economic reality they're facing, that they do not want to lose their jobs and they worry about the economy closing up. Overall, our results here are going to speak to the importance of unified economic policy along with public health policy, because without the economic safety net, it's impossible to think about a containment of the pandemic with this population and in the cities they live. And finally, our fourth set of results is how these findings change over time. We see a slight reduction in belief differences over time, but it's quite slight and the differences are still substantial. So even 2 months of a gap was not enough to reduce much of the differences we see. The discrepancies in risk preferences are stable, and unfortunately the discrepancies and constraints in the ability to protect oneself from the exposure are actually strengthened over time. So I'm not going to discuss the policy implications of these results here because I am eager to get to your questions if there are any. What I want to do is give you very quickly the first set of results, and then I'm going to pause for an interim discussion to see if there are any questions. Okay, so as I explained before, the SafeGraph data is tracking the share of devices exhibiting a certain behavior, that behavior being either leaving home and broken down to, are you leaving home to go to work, full-time, part-time, or are you leaving home for non-work trips? We're going to look at the share of devices in a county C in day T exhibiting a certain behavior. And I'm not going to have any time today to talk about the selection of pings if inactive unless somebody's very interested in it. But we correct for the selection problem that's well known in the SafeGraph data. And we're going to regress that share on the percentage of people living under the poverty line in County C, the percentage of women in the county, the percentage of people who voted for the Clinton in the 2016 election, which we will term Democrats. We're going to allow that impact to vary by the week of the date. So each week we're going to allow the coefficient to differ. We're going to control for other demographics in the county, such as race, education, unemployment rate, as well as factors we believe are shifting the COVID risk, which is the percentage of adults that are older than 65, the degree of urbanization, log of the population density, whether the county is in a metro area. These all affect transmission rates. And of course, the COVID-19 cases and deaths themselves as controls. We're going to put county fixed effects to control for baseline mobility in each county to eliminate any cross-sectional heterogeneity. And we're going to include state week fixed effects to control for anything that's varying over time in the state in terms of restrictions on mobility or other activities that impact mobility. Here are the results. Everything is in one slide, so allow me a minute to walk you through. Actually, before I do, let me actually just make a note about what these betas mean. So if this beta is positive, for example, in front of poverty, that means that counties with a higher share of poverty are exhibiting more of this share of a particular behavior compared to counties with less. Because we are controlling for state weak fixed effects, all the main trends are absorbed. So with that, let's interpret the top row is where we get the estimates of partisan differences. And let's look at these three columns. If they're leaving, the share of people leaving home for work, full-time work, part-time, and not for work. So as you can see, counties that have a high percentage of Democrats are seeing less mobility outside the home for not work reasons compared to counties with higher shares of Republicans. In contrast, these counties are exhibiting more mobility due to work reasons. When we look at income differences, we see a monotonic effect across all kinds of trips. For work and non-work reasons, there is more mobility in these counties compared to counties with lower levels of poverty. So lower levels of poverty, less mobility, higher levels of poverty, more mobility. When we look at gender differences, the more women a county has, the lower mobility it has compared to other counties that have higher percentage of men. And I'm not showing the main effects here, but the main effects are that mobility is declining across all time periods that we have in this regression. We're going from 1st of February to the almost the end of April. Mobility is decreasing. So what this tells you is that in counties where there is more poverty, mobility is decreasing less. In counties where there are more women, mobility is decreasing more. So those are the results from SafeGraph in a nutshell. We like these results because it's based on observational data. However, we can only talk about county level results. Now, to map this to individuals, we have to make certain assumptions. It would be lovely to be able to have individual level data. That's why we will go to the survey in a bit. Also, is this difference driven by differential representation of women, low-income households, and Democrats across different industries that are allowed and expected to work during the state lockdown period? And finally, in the same vein of constraints versus preferences, why are they going out? When we look at non-work trips, are these mostly grocery trips, or are these trips to see their friends and to party? This is going to matter in terms of a pandemic management. Okay, let me pause here and take any questions that you may have.
So since this is a small group, please feel free to unmute yourself and ask questions. Abhishek has a question saying that, does the study include findings over different age groups?
That's a great question. I didn't plot it. So I may be able to talk more in the survey. I don't have results to show you. We did have age as a control, and I don't remember at this point, I used to, what our results are in the SafeGraph data. But I could make those available in the appendix because I think that's a great question.
Anyone else has a question? So Yesim, I have a question, which is, let's pick up the gender results.
Mm-hmm.
Would it be interesting to know how there is a social network effect in these behaviors? For example, certain counties first see more of female-induced mobility, and that starts spreading over to subsequent counties because people started seeing that, oh, even in this county, women who are supposed to be more risk averse are moving out. Maybe we can trust the fact that things are getting better, and as a result, I will also start moving out, and that may spill over in a gender agnostic fashion. Is it
Yeah,
possible to test that in your data?
no, I don't think peer effects are easy to test.
Okay.
Um, and the reason is, I mean, there is you need social connectedness data,
Yeah.
which you can get from Facebook. And
Yeah.
there is a paper out there that's looking at exactly this.
Okay.
Um, but with the data we have, it would be quite hard. I think it's also hard to tease out in general peer effects versus common information. Like the fact that in one county people started to move, is that responding to the same set of type of information around that the next county starts responding to.
Hmm.
So that I'm not sure how to tease out even when I have social connectedness data. But let me send you that paper offline.
Sure.
I recently saw that paper.
And you have 60 days worth of data, right? Or about 8 weeks.
Yes, at this point, I have from the beginning of February. So these are the beginning of each week.
Right.
So you can count, it's about 16 weeks, right?
So potentially you can match it to sudden changes in the external environment, like the president wears a mask, or the Bureau of Economic Analysis suddenly releases like huge job losses, and that changes perceptions, right? That may be
Yes,
worth
so
exploiting.
yes, so we are mostly interested in heterogeneity across people here in this paper. Time, so event studies have certainly been done. It would be interesting to me to see the impact of these events, the differential impact these events have on certain demographic groups. For example, the president wearing a mask is a great example on the propensity to wear a mask, which we
Yeah.
can't see here, but we will
Mm,
in survey data. Yeah. And we're in the process of updating these results to go a little further to
sure.
June. So hopefully, yeah, stay tuned. Any other questions?
I don't think. Okay,
Okay.
Aruna, you
So,
had a question? Yeah.
so in the initial, I mean, I joined in late, so please excuse me if it's mostly lost in translation kind of a thing. So when you were mentioning about the gender effects, in one of the slides, there was this counteracting forces of women known to be very altruistic as well as also known to be more risk averse. I'm just curious about, especially because the consequences of stay at home versus highly mobile in this kind of a context is not just borne by the individual. The consequences also are borne by the others, right? Like mask is, you wear a mask to protect others, and you should not step out. If it is discretionary, you should stay back at home. To that extent, are there any potential sources of information where you can tease out intra-household composition, like women who are part of slightly more diverse age profile may exhibit higher risk averse behavior as opposed to single women or just younger
Yeah,
couples, because the consequences, even if it is at the individual level, will have repercussions at the group level, translating very differently, right? And maybe that's slightly related to the
yeah,
perceptions as
that
well.
is a great point. So not from this data, but from the survey data, we can definitely see the household members.
Okay.
And I hear your point. Like if you have an elderly family member you're living with, do men and women respond the same way? Does the
Mm,
effects differ across whether you're a man or a woman? I love that idea. I will have a look.
Another possible way, I mean, even without the survey data, I'm curious, in the 60-day time frame, is there any event which captures family gathering? I mean, is there some festival, Thanksgiving or something during that 60-day period?
No, unfortunately, there is Easter.
Okay, yeah, yeah, yeah.
There is Easter. That's a very good point. But I think your point is not just the gender, but the family structure.
Yes,
And
yes, yes.
that we don't have in the safe graph data. We have the demographics at the individual level and not in their household.
Ah, okay. But the reason I asked about the natural event in terms of family gathering could be that if you see a spike in that,
Yeah.
that possibly indicates a dense region where there's a lot more, family-based travel. So within the non-work mobility, you can then dissect that into family-specific versus
Yeah, so this is
maybe.
hard to do at this level, and the reason is so look at 411. If I'm not mistaken, 412 or 16, let me see, was Easter. So you don't see a huge, I'm sorry, oops, you don't see a huge difference in terms of gender. Like I said, I would have to be able to divide it by whether they have family close by and so on. But let me think what I can do. I hear your point loud and clear. Again, this paper doesn't take advantage of any event studies, the temporal shifts, but I might be able to get at the altruism point you raised in a different way. Thank you.
Let's move on, Yesim,
Okay.
and then we can come back for
I
an
was
open
trying
Q&A.
to look at the chat. I split my Zoom a little too far, the windows.
There are
from
no
what
questions on the chat window, so we can move on.
Okay, good. Thank you. Okay, so that brings us to the survey. The survey is going to go through, let me just remind you that the survey has 5 waves in April and 2 in June. And we're going to run a very simple regression where the outcome variable is going to be either the action they took, the particular belief we're measuring, whether they have a constraint or not, and the extent of their risk tolerance. Of the individual I in wave T, survey wave T, controlling for, looking at the same demographics, so gender, income of the household, as well as the individual's political affiliation, controlling for age, education level, race, employment status, and then the same COVID risks that we had in the previous regression. We're going to control for, again, state wave fixed effects to absorb any of those events that may be affecting everybody in the states to get at that heterogeneity that we're interested in. Our survey is composed of US adults. It's a nationally representative survey, and we screen participants by an attention check question in minute 2. About 25% of them fail it. So the remaining is in our survey. We have other controls that I talk about in the paper, but I won't have time to talk about here today on health risks. We have surveyed whether they have diabetes, health problems, COPD, etc. I took the list from the CDC website at that time. News consumption and news sources, who they pay most attention to. Okay. So
Yes,
action, yep.
this is on mTurk or prolific or something like that?
This is a good question. This is on Lucid. Lucid
Okay.
Theorem, in fact, is a newish platform. I found the national representation feature of it quite attractive, and
Got it.
yeah, and the quality was pretty good.
Okay, thank you.
Yep. Excuse me. So we asked 2 sets of action questions. These are self-reported. One set, the one to your left, I believe, is about social distancing. Avoid public places and self-isolate. Avoid large gatherings. Work from home. Don't meet anyone outside my household. The other set is much more on the health hygiene and precautions. Wash hands more frequently, wipe down groceries after bringing them home, which is a whole chore in itself, and we are all getting tired of it. Wear a mask when out and about, and wear gloves when shopping. Remember that in April, wearing a mask, there was a bunch of controversy, even from the CDC itself, whether this was a good thing to do, because everybody needed N95 masks. They didn't want to have a run on the store for those. And there was mixed messaging about their efficacy. So it's an interesting time to study it. So here are the results. I'm plotting the coefficients that capture the differences between, for example, let's look at Democrats, between Democrats and Republicans, the Republicans being the baseline. So Democrats, these regression results say, are more likely to avoid large gatherings, work from home marginally, and not see friends or family, and more likely to take hygienic precautions. Women, similarly, are more likely to take hygienic precautions than men, also more likely to limit seeing their friends and family and avoid large gatherings. Now, to me, this was interesting because a priori, I would have expected women to not cut familial and friendship ties as much, because they are usually more connected that way. But at the same time, to Aruna's point, they are more altruistic and therefore perhaps, or risk averse, perhaps their instincts are to protect. Lower income households, here we split the data. If your household income is less than 30,000, 30,000 to 75, and 75 and above being the baseline in the US, this is definitely low income. What's interesting is that they are less likely to avoid large gatherings, work from home, or limit interactions with others, and less likely to take most of the precautions that would protect themselves and those around them. Now, we asked people who said that they couldn't or didn't take an action, why? And we coded the responses to correspond to whether they're constrained or not. And what we did here is we gave certain options to pick from and then an open-ended response as well. Some of the options we gave, for example, around masks, you said you didn't use masks. Why? Pick the one that best corresponds to the reason. Masks aren't useful. That's a preference or belief. I don't like wearing masks. That's, again, not a constraint. I would like to, but cannot find or afford masks. We would code that as a constraint. So you can see the same from working from home. I wasn't given the option. I could, but it's not better not to, or I don't want to. Okay, so when we look at these, the main thing I want you to focus on, the thing that really jumps out, is that the low-income households report constraints as the reason more often for not taking a protective action than higher income households. We don't see large differences elsewhere, again here compared to higher income, but really income and constraints seem to be the heterogeneity that we need to pay attention to here. In particular, lowest income households are more likely to say that constraints prevented them from self-isolating and working from home, and they cite work reasons for this. Now let's move on to the risk realm. First, we asked this catch-all worries. How worried are you about the health or the economic well-being of the following people: yourself, partner, kids, extended family, own community, and all of the US. And if they didn't have, for example, a partner, they would mark not applicable. So here, what I want to first focus on is, again, Democrats and women look alike, and this is controlling for one another, remember? So this is an additive effect. Democrats are more worried in general, but much more about health than about economics, and much more about other people's economic worries. Women, again, are quite worried about, more worried about the men, about health of the people around them, as well as the economic well-being. You can kind of see the kid jump out here. What's interesting to me is low-income people are not more worried about health outcomes compared to high-income people, but they're much more worried about their own and those around them, the people they know well, the economic well-being. So that starts to give you a glimpse of how the lack of economic safety net is going to start interacting with some of the actions that they take or have to take. To measure risk tolerance, we asked a very typical question from the literature called, it goes as thinking about yourself in general, how willing or unwilling are you to take risks? This has been shown to correlate with risk-taking behaviors, both in the lab and in the field, and has been used to measure risk tolerance across the world. So there's a great literature behind it. And lo and behold, we do find that women are much risk tolerant than men. Interestingly, Republicans are more likely to take risks, but the gap is much smaller than the gender gap. Now let's look at risk perceptions or beliefs. We have two sets of beliefs that I want to talk about. One is outcome expectations, what's going to happen to you, what's going to happen to the US. The other is beliefs regarding the effectiveness of precautions at the state level and at the individual level. So the question wording, the wordings look like this. For the own infection risk, we asked, what are the chances you will get infected with the coronavirus in the next 3 months? Severity, we asked, how is the coronavirus likely to affect you should you get infected? There were 5 options: that I'll be symptom-free, I'll have a mild version of the disease, I'll have moderate but not get hospitalized, I'll get hospitalized but no further interventions, or I'll be in the ICU, basically. We didn't ask about death. The US deaths gives information. First, as of April 20, for example, this was the April 22nd survey. As of April 20, 2020, CDC is reporting 41,000 deaths in the US, assuming the state policies remain the same. This was important because later we're going to ask, what if they changed? How many people do you think will die from the coronavirus by July 1st? And for the June surveys, this question was modified to say September 1st, and all the facts from the CDC were updated 2 days prior to the survey. Here are the results. Democrats think there will be more people who died from COVID-19 in the US. Their chance of infection is higher, and the chance of them having no symptoms or mild symptoms, which we added together, is lower. So they're overall more pessimistic about outcomes. There's no difference between independents and Republicans. Women are more pessimistic about the severity of the disease than men, but otherwise don't differ in their beliefs a whole lot. Whereas low-income households are more optimistic about the global risks, the US deaths, but don't differ about their own individual risks. This tells us at least that the lack of heterogeneity in certain dimensions can rule out some of the avenues with which these actions differ from one another. And I want to highlight, before I go on, I know we're just doing very fast a battery of results, but if one were only to ask, for example, US deaths estimate, then you may think that there are no differences between men and women in their risk perceptions. Or that you may think that low-income people are always more optimistic about personal risks. So these results really highlight the importance of looking at the different dimensions of risk perceptions that may be influencing the actions. And to my knowledge, we're pretty unique in this. Now, looking at the beliefs about effectiveness, the way we ask these questions is, what are the chances of you becoming infected with coronavirus in the next 3 months would be if you did not make the changes you made, or if your state did not have social distancing measures. So keeping one constant, moving the other. And we're asking about US deaths if there were no social distancing measures in the US. So a bigger number here indicates a larger reduction. The counterfactual, had we not protected ourselves, is larger. So that would translate into a belief in higher effectiveness of these policies. So Democrats believe that all their own precautions, as well as the precautions that the policymakers took, were effective. It would have been worse had they not been taken. Women feel the same way, about state and own actions on own infection risk. But low-income people don't find any of these effective, or don't want to believe that any of these are effective. I want to take a quick departure from the main results to show you that if we put news sources as controls in these regressions, many of the belief differences go away across the partisan line. So I know it's small, but the way to read it is this is an open, this is a closed circle. The open one is the belief difference estimate without the information controls. And the filled in one is when we add the controls. So you can see that all the belief differences go back to baseline. And so we do no longer see a belief difference between Democrats and Republicans once we control for the types of news they watch. This is not, it's hard to find causal evidence of information on beliefs. There is actually a paper out there by Simonov and co-authors that tried to do this, which is very nice. Here I'm presenting correlational evidence, but it's a smoking gun that highlights that some of the information campaigns are central to the management of this pandemic. Interestingly though, the lower income households' belief differences are mostly stable. So this again tells me that it's not so much the information that they're exposed to, but perhaps some motivated beliefs that they want the cost of certain state restrictions are so high because they don't have an economic safety net that they would rather believe that it's safe. And so we have another paper actually looking at whether the beliefs are motivated or not. Do I see a question?
Yeah, I just wanted to ask. Do you mind if I request you to go back to the slide where you were comparing male versus female risk perceptions were similar, but the response to severity was higher for females, right?
Yes.
I think this one, yeah. I'm just curious because you had the gradation response to the severity, like you may get infected, but proved to be asymptomatic, and all the way up to ending up in ICU. Did these, I mean, was it like an aggregate measure? You just summed, because the severity is actually not linear, right? I want to see where the departure is highest.
I see. We did some robustness checks. You can do a couple of things. You can of course, these are dependent because they add up to 1. So what we did is we looked at the low end of the scale, add up symptom-free and mild. We see differences. You can do the opposite. You could look at the very high end, for example, add up the severe version that requires ICU and the hospitalization. You get the same thing, just on the other side. So it doesn't matter how you treat this. There are gender differences. If you're asking me where it mainly comes from, I believe it comes from the hospitalization and the ICU.
Yeah, so I got curious about, the series of results that you were showing, which essentially is at the beliefs level, right? Could it be a good speculation to have that despite having comparable beliefs, the actions may differ significantly from one group to the other? Now, how do you respond to the beliefs is also an equally good exploration to have, which is, a good testimony of that direction is what we see in this male-female. The beliefs about the risks are the same, but one gender is responding to the severity in a very different way. And if you extrapolate that to income and even the political affiliation, they may be having the same beliefs in terms of the consequences. That's how you're measuring, right? But how do I respond to the consequences is may still be driven by individual
Very much so.
action. So I don't know how to bridge these. I mean, did I articulate it well? I'm not quite sure.
I'll try to do my best with what I understood, and please go ahead again if I misunderstood. I believe, like all of us, you're trying to make a causal story. What is it that's driving the differences in actions? That's what we're curious about too.
Absolutely, yes.
But like I said in the very beginning, this is a descriptive paper that's not going to push the causal envelope. The reason is exactly what you said. Just simply documenting differences in beliefs doesn't guarantee that beliefs cause the actions. In fact, like I was trying to mention, actions can cause beliefs. There are all kinds of issues there. We are in good company with a lot of papers that are descriptive, that are looking at these correlations. I think here the objective is to examine where we see heterogeneity, where we don't, we can kind of deprioritize, and then hopefully this will start the generation of discussions that we're having that further gives you studies that get into the causality. But even establishing causality is pretty difficult because there are, even in the simplest model of risk, decision-making under risk, there's so many factors that come into play. Risk preference, which is what you do with those beliefs, and the beliefs are multifaceted. It's not just about probability of infection. It's what happens to me when I get infected. It's also how much do I care about the US deaths and my altruism that multiplies with this. So I don't think any single paper is going to do a tremendous job. We're just trying to chip at it. So at this point, my best answer is I agree. All of them could be driving actions where you see heterogeneity, and this paper is not going to tell you which one. And I don't believe there's an answer that one of them is. It's probably a combination. Does that get at your question a little bit?
Yeah. I just have one more, if you don't mind.
Yes,
I'm just curious about, the fact that we start off with this calibration about how likely is the infection going to affect you, right from being asymptomatic to ending up at the ICU. There's a non-linearity, right, in the way you're moving from one end to the other. Can it be handled in a different way from what you had looked at currently, like all of them adding up to one? Do you want it to be like, alive is one, but, chances of death triggering could be another extreme? Like, I'm just a little curious about potential ways of treating this in a different way. If you feel
yeah, so the problem is the question was asked as probability that you will end up in one of these states. So it does add up to one.
It's not conditional on, so the last two questions are not conditional on you being symptomatic and you being infected. Will you end up in ICU? It's all like.
So literally, this question was phrased as you see on the screen.
Okay.
Coronavirus is likely to affect you should you get infected. The chances I will be symptom-free, chances that I'll have a mild version, those added up to 100%. So the probability distribution wasn't like conditional on you have symptoms then. It was
okay. Got it.
The joint probability is what we asked.
Okay.
I think it's very hard for people to understand conditional.
Understand it already. I know. Yeah. Thank you so much. Thanks a lot.
Yeah, absolutely. Okay. Thank you for that discussion. Here we were, suggestive evidence that information matters for beliefs. Again, like I said, this is a smoking gun. What I want to now do is compare the April results with the June results. It's hard to see by eyeballing, but I wanted to show you both results. And of course, the error terms, the bars are going to be wider here because there are fewer people in June, 2,500 versus 5,500 in April. But overall, the patterns are the same, where Democrats are more pessimistic, although it does go towards zero just a tiny bit. women are still more pessimistic about the chance of having it mild. There are some shifts in the income that I don't know why, but overall my takeaway is the same patterns between men and women and Democrats and Republicans, where we saw the main differences in beliefs, persist. Differences in constraints get bigger. So these are plotted on the same scale. As you can see, the proportion of lower income people that cite constraints as a reason for why they can't self-isolate or they still go to work are larger. Finally, differences in actions. We don't have a lot of time, but let me quickly show you that the patterns are the same. The mask difference definitely gets larger because the mask issue gets politicized by June, but other differences are attenuated. In fact, what's interesting to me is, except for work from home, all the differences across the low-income groups are attenuated. So it really tells me, when I look at this data, a constraint story. Okay, let's put it all together. I want to have a few minutes at the end for questions. On the political divide, we see belief differences are largely attenuated by information consumption, and belief and action differences slightly decrease over time. These all, to me, highlight the role of consistent messaging. For gender, differences in risk preferences, which I didn't show you, and perceptions are stable over time. Risk aversion may be socially beneficial in this case. All this literature talking about the fact that women are more risk averse, talk about how they're harmed by it. This is a good case where there is a case to be made for risk aversion. And I think there's role in this pandemic for more female leadership and the effectiveness of messaging to women through messages of risk and consideration of others. And on the income front, there is a multidimensional poverty gap, which is very close to my heart in terms of research agenda. They have higher exposure risks because they're frontline and working. And all of this is mostly driven by constraints and not differences in the fact that they feel invincible or they think that nothing's going to happen to them. And there may be a potential indirect effect that we're exploring in a different paper with different data, whether beliefs about the effectiveness of policies and support of such policies comes from the lack of the economic safety net, the fear that they have about their livelihood. And this really highlights the fact that we must consider both the direct and the indirect, through beliefs, impact of economic safety nets on disease transmission. That's all I have for you, so let me take a few more questions if there are any left.
Yesim, Mayank's question is about controlling for education and taste for science.
Yeah, so I don't know about their taste for science, but we do control for education level, high school, whether they finished high school and whether they finished college.
Any other questions, anyone?
Let me move my...
Looks like we're good. So let's wrap up. Thank you so much, Yesim, for your time. Wish you safety and good health. And hopefully you'll take forward this project and the other projects and inform policymakers for SARS-CoV-3 if it comes to hit societies. Whether we are around or not, hopefully that will be paid attention to by our future generations. And thank you very much again. Stay safe.
Thank you for inviting me, and thanks for everyone for joining. Bye-bye.
Bye-bye.